Because it's immunotherapy, what it does is it actually stimulates the body's own immune system to fight cancer cells, target cancer cells. Now, traditionally, immunotherapy, as indeed most forms of chemotherapy, have been delivered into veins, intravenously. And that normally is a slow infusion process, taking at least an hour. And also means that we need to have permanent lines into veins. It's a lot more inconvenient, not just in terms of time, but in terms of actually access to veins and pain at the site of infusion. This new form is the same drug, but actually modified to be delivered subcutaneously, which means just under the skin. So it's given as a very fine injection over a minute or two under the skin, either in the tummy or in the thigh, and has exactly the same efficiency in treating the cancer as the intravenous or IV drug. But the advantage, obviously, is that the patient comes in and has his or her treatment over a period of 2 to 5 minutes maximum. That is a huge significance for patients in terms of spending time in the hospital. Even though we have the most amazing oncology suite, it means that the disruption to patients' lives of spending time in hospital because they need recurrent treatment is significantly sort of reduced by giving it in this way. It's a much more patient-friendly way of giving it, as efficient, no greater or no lesser side effects, really.
So it sounds more comfortable, quicker.
Correct.
What impact will this have perhaps on a patient's mental well-being as well as physical?
Yeah, huge, because I mean, there are many aspects in terms of mental well-being for cancer treatment, as you can imagine, surrounding the whole diagnosis, the whole treatment, the whole anxiety about the future. But actually one of the more practical aspects in terms of mental health and anxiety is an actual amount of time one spends in hospital, and the disruption that creates, not just for the patient, but for the family. And returning back to work, for example, after the treatment, or even returning just simply home after a couple of minutes is a very different proposition to spending an hour in an infusion site, in an infusion suite. So it's very significant from that point of view. It's significant because it just shows that we're always trying to sort of improve the experience for the patients, not just in terms of clinical outcomes, but as I said, the clinical outcomes for this may well be the same, but the significance for the patient, as you've actually alluded to, are very significant. So from our point of view, it shows that the GHA is always trying to be innovative and always trying to keep up with developments that actually improve patient experience, not just clinical outcomes.
Apart from the patient experience, I imagine, does this also help ease the pressure in terms of resources and workload for your staff?
Sure. And also in terms of turnover, the number of patients that we can see, for example, the number of patients that we can treat in any one session is significantly increased. So on all fronts, it's a big milestone, and it means that patients can actually sort of access services easier and quicker, and turnaround will be much lesser. So yes, very significant from a practical point of view for us in terms of workflow. Are
all cancer patients eligible, or is it limited to certain cases?
No, I mean, this form of immunotherapy is specific to some cancers. It happens to be sort of one of the immunotherapy treatments that actually covers a significant number of cancers. For example, head and neck cancer, solid melanoma, breast cancer, cervical cancer, and not all the types. So it's specific to different types of those cancers. In terms of cancer treatment, it's one of the wider ranging forms of treatment that we have. That is immunotherapy, not chemotherapy. But is specific to some types of cancers, yes.